All right, November is American Diabetes Month, and we're here to talk about that a little bit. Need to address the issue. First of all, what is diabetes?
Diabetes is a term given for a person who has an inability in their body to use the glucose the way it's supposed to, or the insulin that it's supposed to.
Right.
The insulin burns down the glucose, which is the sugar that you take in, and some people have a hard problem getting rid of that sugar in their body.
What are some of the symptoms for somebody if they're thinking, maybe this is something that's coming
Right.
my way?
The signs and symptoms is an increased thirst. If you're going around and you're thirsty a lot, or you're having a lot, you have to go to the bathroom a lot, urine-wise.
Mm-hmm.
You're needing to go to the bathroom a lot. Sometimes you'll have a great weight loss at first it's unexplained. You don't know
Right.
why. You're eating and eating and eating and you're losing weight. And then once it gets to a certain stage, then you'll start gaining weight. And then you'll have an increased hunger. You'll go around and that you're hungry all the time.
The majority of people that are at risk, what are some of those, if you want to generalize a little bit?
Okay, let me give you some categories. You especially want to pay attention to the people who have diabetes that run in their family. Grandmother, grandfather, mother, dad, sister, brother, anything like that, you want to always make for sure that you keep a check on it because it is your family history and it is passed down.
Right.
Doesn't mean that it's always going to be passed down, but there's a high chance that it will. Anybody who is overweight is at risk for it. Anybody over the age of 40 needs to get checked for it at least annually. And then African and Native Americans and Latino descent are at higher risk.
Okay, so watch out if you fall under any of these categories.
Right.
Diagnosis, treatment, other issues we need to move on.
Diagnosis, if you go into the doctor and your blood sugar level, a lot of people, if you've seen them, they'll stick their finger and check their sugar level in their blood. If that's above 140, the number 140, at least 2 different occasions when you've had nothing to eat or drink on that's a warning signal. That's what we're going to say, hey, you're probably diabetic. We're going to do some further testing. Go ahead and do a little bit further testing once we find out if you do or do not have diabetes. If you do, first you try, according to the levels now, as long as you're not out the roof on your levels, first we'll try diet and exercise, try to modify some of that. If that's not working after we've tried that a month or 2, then there could be, medication involved and possibly insulin injections. Very, very bad complications from this if you do not get it treated. Kidney failure, heart problems, circulation problems, vision failure.
Right.
So, there's a lot of things, a lot of people think, oh, I can have that cake, I'm diabetic, but I don't ever get it checked. You're really playing with your life, not just, hey, I could lose a leg. You're playing with your life.
Thank you so much for educating all of us, of course. November, American Diabetes Month. Hope you get educated a little bit more throughout the month. We'll be right back with more Mountain News This Morning.